Diabetes in men over 40 is a significant health concern, demanding increased awareness and proactive management. The American Diabetes Association estimates that a notable percentage of men in this age group have diabetes. Diabetes is a condition where blood sugar levels are too high, either because the body doesn't produce enough insulin or can't use insulin effectively. This video aims to inform men over 40 about the specific risks, signs, and symptoms of diabetes, emphasizing early detection and management. Common diabetes symptoms affect both men and women, including increased thirst, also known as polydipsia. Frequent urination, especially at night, or polyuria, is another key indicator. Unexplained weight loss and increased hunger, or polyphagia, can also signal diabetes. Other general symptoms include fatigue, weakness, and blurred vision. Slow healing sores or cuts are also common signs that should not be ignored. Now, let's discuss symptoms more specific to men, starting with erectile dysfunction, or ED. Diabetes can damage the nerves and blood vessels required for erections, leading to ED, with as many as 75% of men with diabetes experiencing it. High blood sugar levels can also increase the risk of fungal infections, such as genital thrush. Reduced muscle mass is another symptom, as high blood sugar can cause the body to break down muscle for energy. Several risk factors increase the likelihood of developing diabetes in men over 40. Age is a primary factor, with the risk of type 2 diabetes increasing significantly after 45. Being overweight or obese is a major risk factor, and men tend to face diabetes risk from lower weight gain than women. A family history of diabetes, a sedentary lifestyle, and an unhealthy diet also contribute to the risk. High blood pressure and abnormal cholesterol levels, such as high triglycerides and low HDL, are additional risk factors. Certain ethnicities, including African American, Hispanic/Latino, Native American, Asian American, and Pacific Islander, also have a higher risk. Untreated diabetes can lead to severe complications, including heart disease. Diabetes significantly increases the risk of heart problems, such as coronary artery disease, heart attack, and stroke. Nerve damage or neuropathy can cause pain, tingling, and numbness, especially in the hands and feet. Kidney damage, known as nephropathy, can impair the kidney's filtering system, potentially leading to kidney failure. Eye damage or retinopathy can harm blood vessels in the eyes, potentially leading to blindness. Foot damage, due to nerve damage and poor blood flow, increases the risk of ulcers and infections. Erectile dysfunction is also a common complication of long-term, unmanaged diabetes. It is crucial to see a doctor if any symptoms are present, especially for men over 40 with risk factors. Diabetes screening and diagnosis typically involve blood tests like fasting plasma glucose and the A1C test. Regular checkups and annual physicals are vital for early detection and management. Proactive health management, including diet, exercise, and weight management, can significantly improve outcomes. In summary, understanding the signs and symptoms of diabetes in men over 40 is key to early detection and management. Don't wait. Talk to your doctor about diabetes screening and risk factors today.
Men over 40 face unique challenges with diabetes, with risk increasing significantly after age 45. This is often linked to increased weight, decreased physical activity, and age-related metabolic changes. Recognizing these signs and understanding complications are crucial for proactive management and improved quality of life. While some symptoms are common across genders, others manifest differently or are more pronounced in men. One common sign is frequent urination and increased thirst, as elevated blood sugar prompts kidneys to expel excess glucose. Unexplained weight loss can occur despite a normal or increased appetite due to inefficient glucose utilization. Persistent tiredness and weakness, or fatigue, arise from the body's inability to convert glucose into energy effectively. Blurred vision is another symptom, as high blood sugar levels can cause changes in the lens of the eye, affecting focus. Slow healing sores are also a concern, as poor circulation and impaired immune response hinder the healing process of cuts and wounds. Beyond these general indicators, men may experience symptoms unique to their gender. Erectile dysfunction, or ED, is significantly more likely in men with diabetes due to damage to blood vessels and nerves. Genital thrush, or candidiasis, is another male-specific symptom, increasing the risk of fungal infections around the penis. Reduced muscle mass can result from consistently high blood sugar levels, as the body breaks down muscle and fat for energy. Low testosterone levels are also linked to type 2 diabetes, leading to reduced sex drive, fatigue, and further muscle loss. Several factors increase the risk of developing type 2 diabetes in men over 40. Age is a primary factor, with the risk increasing significantly after 45. Being overweight or obese, especially with a waist circumference over 40 inches, significantly raises the risk. A family history of diabetes also increases the likelihood of developing the condition. A sedentary lifestyle, poor diet, and excessive alcohol consumption contribute to the risk. Certain ethnicities, including African Americans, Hispanic/Latino Americans, and Asian Americans, have a higher risk. Prediabetes, where blood sugar levels are higher than normal but not yet diabetic, is a major risk factor. Unmanaged diabetes can lead to numerous serious complications. It significantly increases the risk of cardiovascular disease, including heart attack and stroke. Nerve damage or neuropathy can cause numbness, tingling, and pain, especially in the hands and feet. Kidney damage or nephropathy can affect the kidney's filtering system, potentially leading to kidney failure. Eye damage or retinopathy can lead to vision loss and even blindness. Foot problems, including ulcers and infections, are common due to nerve damage and poor blood flow, sometimes requiring amputation. Sexual health issues beyond ED can include retrograde ejaculation and reduced libido. Other complications include increased risk of Alzheimer's disease, depression, hearing impairment, and certain cancers. Effective management and prevention strategies are vital for men over 40. Lifestyle modifications are key, including a balanced diet rich in whole grains, vegetables, and lean proteins. Regular exercise, aiming for at least 150 minutes of moderate activity per week, is also crucial. Weight management, even modest weight loss, can significantly improve blood sugar control. Medications like metformin or insulin therapy may be necessary if lifestyle changes aren't enough. Regular monitoring of blood sugar, blood pressure, and cholesterol levels is essential. Stress management techniques such as deep breathing or yoga can help, as stress can elevate blood sugar. Quitting smoking is also vital, as it increases the risk of diabetes-related complications. Men over 40 should consult a healthcare professional if they experience any diabetes symptoms or have risk factors. Regular screenings are crucial for early detection and management, especially for those with risk factors. Early intervention can significantly reduce the risk of long-term complications and improve overall health outcomes. Thank you for watching part 2 of our series on diabetes in men over 40. Stay informed and stay healthy.